Hi, my name is Frankie, and this presentation is an overview of my remote internship experience at the University of Nevada, Reno, School of Medicine, Office of Clinical Research. The Clinical Research Office is an arm of the UNR School of Medicine. The Clinical Research Center integrates research expertise and resources for clinical, translational, and biomedical researchers. The UNR School of Medicine's overall mission is to improve the health and well-being of all Nevadans and their communities through excellence in student education and postgraduate training that produces global leaders in medicine, clinical care, safety and innovation, research with local, national, and global impacts, and an institutional culture of diversity and inclusion. Their vision statement is a healthy Nevada. The internship project addresses vaccine hesitancy in accepting the influenza and COVID-19 vaccines during a SARS pandemic. A statewide survey was used to measure the attitudes of providers and the public in Nevada to understand the barriers to vaccine acceptance. The survey analysis focused on the free text responses of those who were vaccine hesitant. The public health problem addressed during the internship was the public and state healthcare providers' survey results have documented hesitance in acceptance of the COVID-19 vaccine. A community needs assessment was required to measure Nevada's attitudes to understand the barriers to vaccine acceptance. The research aims to develop education materials, tailor outreach communication both to rural and urban areas of Nevada, and improve vaccine acceptance. The Johns Hopkins Coronavirus COVID-19 Global Case Center for Systems Science and Engineering reported that as of February 22, 2022, the SARS-CoV-2 virus had infected over 77 million Americans and had caused over 900,000 deaths. The CDC said that 32% of Nevada's adult population aged 65 plus had not gotten the influenza vaccine for the 2018-19 flu season. To increase knowledge, a literature review of the negative perceptions of vaccines was conducted. To do this project, an assessment began to investigate evidence-based research on content analysis of free text responses, and during this time, the resources for data analysis were identified. I then began to plan the possible analysis strategies to use with the data. A sampling framework was formulated and coding rules were developed. The data file was cleaned and sorted so that demographic variables and free text responses could be coded. Themes in the free text comments were identified and coding of those themes began. I regularly attended meetings with the proctor and the faculty advisor to discuss challenges and recommendations and identify the project scope. The sampling design was executed and intercoder reliability was tested. The coding design was executed for the entire dataset. In the evaluation phase, all the data that had been analyzed was included in a research manuscript to describe the methods and data results. Recommendations were made for increasing vaccine uptake and future research areas. Lastly, to interpret findings for public health practice. These were the 6 public health competencies that were addressed throughout the internship experience. These include cultural competency, needs assessments, data analysis using computer software, interpretation of the results using information technology, and working on interprofessional teams. I am confident that my project will help the UNR School of Medicine's Clinical Research Department and the external stakeholders for the project because of the feasibility needs that have already been addressed. My evaluation can also support the actual interpretation of the results through the recommendations that I have made. Finally, my project recommended future research areas which could ultimately support the survey success. The internship has positively affected my growth and my competencies, learning, and understanding of the many areas of public health. I have a better understanding of the steps needed to analyze data and to interpret the findings. I've identified my strengths and weaknesses in the areas of knowledge growth. I have reaffirmed my passion for research analysis on vaccine hesitancy and have become more confident in trying different analysis techniques. And I feel more confident in my leadership skills. I'm grateful to the UNR School of Medicine and Dr. Riddle for the opportunity. It was a pleasure to work with him and produce a research report that I hope will serve in helping increase vaccine uptake in the future. Thank you for watching.